Science Cafe. Science cafes provide a relaxed, open venue for non-scientists and scientists to discuss current topics. I am excited that we are hosting tonight's Science Cafe. I want to start by thanking the Last Round Bar and Grill staff for opening on a Tuesday for us. Thank you to Heather, Steph, and Nick. My name is Laura Gardner, and I will be your moderator tonight. I am a local school librarian and chair of a local chapter of the Climate Reality Project. You can find out more about our future science cafes by following us on Facebook, New Bedford Science Cafe, or by signing up for the email list on the website. We have a small steering committee. Please wave if you are on the Science Cafe steering committee. Thank you. A few bit of housekeeping items before we introduce our speaker. As I said, thank you to the Last Round Bar and Grill for opening up for us. Please show your thanks by ordering lots of food and drinks. Tonight's talk will be recorded by New Bedford Cable Access. Thank you. And bathrooms, in case you're curious, are located in the back down the stairs. And please do say something if you cannot hear the speaker. We want to make sure everyone can hear tonight's talk. Our talk tonight is important and timely. Dr. Jennifer Nuzzo is the director of the Pandemic Center at Brown University and a professor in epidemiology. Since 2022, over 148 million birds have been euthanized due to efforts to control the spread of H5N1. Egg prices have skyrocketed, some cows have become infected, and 68 people in the US have contracted the virus. So far. Yikes. I am so grateful that tonight we have an expert here to explain the ins and outs of bird flu and answer the question in our title, how worried should you be about bird flu and other pandemic threats? Please join me in welcoming our speaker, Dr. Jennifer Nuzzo.
Thank you so much. It's a wonderful introduction. It's really wonderful to be here. I'm so heartened to see so many people here. I think that was an unfair title of the talk because you're showing up here wondering how worried you'd be. I'm going to answer you, and I don't mind if you leave now that you've gotten the answer, which is that I always say worry is not a public health intervention. So don't be worried, be informed, and hopefully by the end of this we'll be a bit more informed, and then you can take that information and use it as you wish. So I'm going to talk about H5N1, and I want to start with a story. And the story starts with a 3-year-old boy who shows up at a hospital with his family, very ill, diagnosed with influenza, but not an influenza virus that anyone had seen. Quite tragically, the boy dies. And this starts a global scientific investigation that even includes the boy was in Hong Kong, but it includes scientists at the U.S. Centers for Disease Control and Prevention trying to understand what made this boy die because it wasn't the usual seasonal influenza. Ultimately, they discovered it was a completely new influenza virus, influenza H5N1. So influenza A, H5N1. And what follows is a massive outbreak investigation and massive culling effort that resulted in the discovery of 18 cases of infection, diagnosed infection as cases. 6 of those died. And massive culling of birds because it was determined that this H5N1 virus was an avian influenza virus. So not a usual human influenza virus, but an avian flu virus. So this story probably sounds like something you've heard in the news lately. But this is a story from 1997. So just to say, we have been thinking about this virus for a really long time. It is a very worrisome virus. We continue to be worried about it. As much as I've said worry is not a public health intervention, we have been watching with concern this virus and reacting to it for a long time. There are reasons why you may not have heard about it until more recently. And so I'm going to talk a little bit about that. So since that first discovery of this virus in 1997, we have watched H5N1 do some really concerning things. So after that initial outbreak, despite a massive operation to cull birds, to control the outbreak in humans, and I have to stress, it was not thought to be spreading between humans. It was mostly people who were exposed to the infected birds, although scientific studies later discovered that there may have been some limited transmission between the patients who are in the hospital and healthcare providers, but not enough to see sort of dying healthcare workers, which if you're hearing about a new outbreak, when you hear about dying healthcare workers, that is always one of those really worrisome things. So very limited person-to-person transmission, not sustained person-to-person transmission like you see with influenza typically. Over these now many, many years, H5N1 has gone on to cause outbreaks sporadically, and there was a period of really intense activity in sort of the early aughts, around 2004, 2003, where we were starting to see outbreaks occurring in different parts of the world, but mostly in sort of Southeast Asia. Around 2005, 2006, there was a lot of heightened concern. At that point, we were seeing this new flu virus that was sickening people. Again, people who had direct exposure to infected birds, because it was and still is an avian influenza virus. Seeing that of all those infections that we found, about half of them died, which is a really stunning statistic. Even if you assume that you probably can't find all the infections that happen, that maybe you're missing some mild ones. Knowing that of the cases you find, to have 50% of them die, that is quite a stunning virus. And not only did they die, but the people who got it, got very, very ill, and it involved multiple organ systems. So this virus was prompting concern about, first of all, protecting the people who may be exposed to the birds, but also prompting concern that influenza viruses have been known to cause pandemics. In fact, they regularly cause pandemics. In fact, they caused 3 pandemics in a span of, about the last 100 years. And people who have studied avian influenza viruses and how they change and go on to pandemics, cause pandemics, generally think that here's a common formula, which is that you have an animal flu virus that somehow gets the ability to infect a human, and then in order to become a pandemic, it has to spread easily between people. So if I got it, I could give it to somebody else. So far, H5N1 has not been able to do that, but it has a lot of red flags. And it had a lot of red flags from the very beginning. So watching this virus, taking very carefully, anytime you see an outbreak in animals, needing to respond swiftly, not only to protect other animal populations, right? If you have it in a bird, a domesticated livestock, bird population, needing to control it because you don't want it to spread to another domesticated bird population because this virus kills birds. But also making sure that it doesn't spread to people because it's a very deadly virus when people tend to get it. And also making sure that we don't give the virus a runway to gain new skills to possibly become better adapted to humans such that it could more easily infect and spread between people. So that's the whole summary of why we have worried about this virus. But over the years, it's done sort of interesting things. The first thing is that since those early days, cases have continued to occur, but there was a period of quiet. So didn't hear much about it. There was that intense period in the 2004 timeframe, And certainly there's an intense period now, but in between, not too much activity. Didn't hear about it. Also, we continue to find infections over time, and over time, those infections, on average, have become less deadly. Let me phrase this very carefully, which is what I want to say is that although the number of cases continues to increase because new ones are occurring, deaths are increasing more slowly. And I'm being very, very careful there because I don't want to imply that the virus has become less deadly because we don't know that. So that's a really interesting hypothesis. Why, if over the span of time, we are seeing maybe fewer deaths, but we are continuing to see cases? And I will tell you the answer to that is just still unknown. We are also, just to say that by now, we've had about 900 some odd cases of H5N1 to date that we have ever been able to find. And that 50% statistic applies. But most of those deaths occurred earlier. In the last couple of years, H5N1 started making news again. And it started making news for a number of reasons. And I say that because if you weren't someone who was really paying attention in the way that some of us were, there was a lot of news about it around 2005. But then we didn't hear about it. But in the last few years, the news cycle started again. And the reason why that was happening is we started seeing the virus do new things. The first thing is it really expanded its geographic distribution. We were starting to see it in countries that never before reported H5N1 infections. Red flag, another red flag there. Another red flag is that it started causing infections in animal species that we never saw it do before. And most concerningly, we started to see the virus infect, and in some cases, in a quite deadly manner, mammals. Now, why is that important? Well, if you're talking about the question, will this bird flu virus get better at infecting humans? Seeing it get better at infecting mammals doesn't make you feel very good. So this has been kind of happening over the last few years. There's also been a really interesting and concerning increased mutations being seen in the virus. And that, again, red flag, makes us concerned that maybe the virus is just getting better at sickening individuals. Maybe, every time it mutates, there's always the possibility that it gains a skill that you don't want it to have. That's been another concern. It has also now shown itself capable of infecting animals, mammals, that humans have very close contact with. And probably the biggest one that you've been hearing about is cows. Now, seeing H5N1 infect cows on US farms, this was reported now almost a year ago, was surprising for a few reasons. One, the US hadn't really reported much by way of H5N1, certainly not like we've seen in the last year. But two, nobody really knew that cows could get the type of influenza virus that this is. So this is an influenza A virus. There are multiple types of influenza viruses. Cows had not been thought to be a major source of influenza A infections. So seeing this virus turn up in a cow, or in this case, multiple cows in Texas, now almost about a year ago, was concerning because it's now yet another species that this virus is capable of infecting. But two, it is a species that we as humans spend a lot of time, very, very close time. And this wasn't just any kind of cow, these were dairy cows, so people are very close to dairy cows. So since then, there have been now more than 60 human infections reported in the United States. The majority of these infections have been in farm workers. people who have been exposed to either infected cows or infected chickens. In some cases, people have gotten sick going in to depopulate or kill infected flocks of chickens. We respond very aggressively to H5N1 infections in birds, particularly domesticated birds, for a few reasons, but the biggest one is that this virus is lethal to birds, and so the poultry industry very much doesn't want the virus to spread to the rest of the industry. So they respond very aggressively by killing the entire flock. That's one of the requirements. And as we saw over the summer, we saw a huge cluster of cases in farm workers who were sent in to kill these infected birds, didn't have personal protective equipment. It was really, really hot, and a whole giant cluster of cases occurred. Where we are today with this virus is as follows. One, the majority of these recent cases that has occurred in the United States have experienced mild infection. They have not been hospitalized. Why that is, we just don't know. I will tell you in a second why I am not assuaged by that. The second kind of observation is that we are now starting to pick up infections in people who don't have a known, so don't have an exposure to animals, meaning there have been a few cases, mostly children, that were detected as being infected. They had mild infection, fortunately, but they weren't farm workers. We don't know where they got the virus. But those are rare. The vast majority of the cases that we know about are people that we know have had direct exposure to sick animals. Now, some people will look at this situation and say, well, this virus keeps spreading. The trajectory of the virus is such that we do see fewer deaths as of late. And certainly when we look at the cases in the United States, the majority of them have not had to go to the hospital. The majority of them have not died. That does feel quite different than what we saw in those early days when we were first tracking the virus. There are a few hypotheses for this. One hypothesis is there's this idea in biology called original antigenic sin, which sort of argues that perhaps your previous exposure to a pathogen may sort of train your immune system above all. But by that hypothesis, it's probably not just if you've ever had something in the past, but what your first exposure is. So if you had, as your first exposure to an influenza virus, infection with, say, maybe another influenza virus, maybe H1N1, that is a commonly circulating influenza virus, that perhaps that has given your immune system a bit of an advantage in responding to H5N1. And there's some interesting data that suggests that this could be the case. H1N1, remember I said that we've had a lot of influenza pandemics over time? We had a pandemic of a new flu virus. So as we are tracking H5N1, in the early aughts, seeing these terrible outbreaks and thinking, another pandemic could be on the horizon, better get ready for it. And frankly, that was a really galvanizing set of circumstances that is frankly the reason why we have any kind of pandemic preparedness enterprise in the United States. As we were watching H5N1, another virus came in through the back door, and that was H1N1, which caused a pandemic in 2009, which you may or may not remember. I certainly do remember, but that was a swine origin virus. That virus that caused a pandemic in 2009, fortunately a mild pandemic, nothing like COVID-19, nothing like the 1918 Great Influenza, mild pandemic, so mild that now I find when I talk to people, they don't remember we even had it, which is, I'm heartened by it. I don't want you to have to remember it. But I will say that virus is with us every year as one of our seasonal flu viruses. So it is possible that people may have gained a little extra immunity because their first flu infection was an H1N1 virus. That is one hypothesis. It's also possible that the way farm workers are being exposed, again, most of them are occurring in dairy workers, that somehow that kind of exposure is not enough to prompt, or not the right kind of exposure to prompt a very severe illness. There's a lot of other ideas out there, but I would just say that they are all hypotheses at this point. And they're not enough for me personally to throw out the 20 plus years of data that we have on this virus that has said that, of the 900 cases that we've had so far, half of them have died. It's also not enough for me to throw out data that we have from animal models. So one of the ways that we study influenza viruses is you can expose ferrets, because ferrets are a pretty close proxy for human infection. What would happen if a human were to become infected? Ferrets are an important way that we study flu viruses. And when ferrets have been exposed to the virus that's circulating on dairy farms, even the virus that it's circulating in birds, they're slightly different, they get very ill and they die. So I'm still worried about this virus. There have been two cases of severe illness associated with this more recent crop of infections in the United States. And one of them is in British Columbia. So one was a teenager in British Columbia infected with H5N1, unknown exposure. Probably it was a bird. I'm gonna shorthand this to say that there's a bird version going out there and a cow version going on around there. The teenager in British Columbia lived next to a wildlife preserve, so possibly some kind of exposure from the birds. This teenager got very, very ill, was in the hospital for more than a month, and is still receiving care, so quite a severe infection. The other death occurred the other severe case, the teenager did not die. The other severe case occurred in Louisiana, someone who had backyard chickens that had been infected. This patient had some underlying health conditions, but I don't, throw out that as like, well, a lot of us have underlying health conditions. So those two data points, I think, reaffirm for us that H5N1 can be deadly. Some of the analysis of the virus of both of those patients has indicated that the virus likely mutated within the patient to enable it to cause more severe illness than it might have otherwise. And so what I take away from that is that it is really hard for us to know who's going to get really, really ill and who's not. And so for that reason, I remain concerned about this virus. And when people ask me, how worried should I be? I tell them, worry is not a public health intervention, but the people that I want to take action are people who are working with animals who are likely to be infected. If that's not you, I want you to be informed about this virus. I want you to be informed because you know what? Things could change. And we want to take action today as a country, as a globe, to try to prevent that change. The change that we're worried about is that the virus could gain new skills and cause a pandemic. But I don't think that today, if you're not someone who's working with animals who could become sick, that this is something that you have to worry about. Meaning, if you are if you're touching animals, if you're being exposed to animals, take precautions like you should always do, because animals can carry lots of different germs. But I am not worried that you're going to contract H5N1 out there. Yes, there have been some cases that we don't know their exposure, but again, that's quite rare as of this point. I do not know if H5N1 will cause the next pandemic. I don't. It may never. I don't have any reason to think biologically that it can't. There are no data that says, no, it's not going to be this virus. We could get another curveball like H1N1, where as we are fretting over H5N1, something comes in the back door. What I do know, and I'm saying this as someone who's director of the Pandemic Center at the Brown University School of Public Health, is that we are going to have another pandemic. We have them multiple times a century. And the frequency with which we see new viruses emerge and cause outbreaks, when we look at the data over the last almost now 100 years, we see a very increasing drumbeat. Each decade, we see more and more new viruses emerge and cause outbreaks in people. They don't all go on to become pandemics. They don't. Why they don't? Sometimes it's a matter of luck. Sometimes it's a matter of our very swift response. Sometimes it's just a matter of behavior, etc. But the fact that those conditions that give rise to new pandemics are increasing means that we are going to have more of them in the future, or we could have more of them in the future. Now, that's probably a really depressing thing to sit with. It's probably really depressing to sit with in like this moment in time in particular when there is massive political change happening. And I'll be honest with you, I am depressed about that. I will say though that if you take a step back, I believe it is completely within our reach to take pandemics off the table. Meaning, we may have outbreaks of new concerning disease. We may see them happen more and more frequently. I think there are things we can do to actually buy down that frequency. But we will still continue to have them. But it is possible for us to be able to respond to these events swiftly, to prevent them from having the runway they need in order to become a pandemic. It is also possible for us as a society to increase our resilience to these sorts of things. And here I'm going to just really channel what we have been able to do for other recurring hazards. We know the frequency of floods is increasing. We know the frequency of extreme weather events is increasing. We also know that there are decisions we can make as communities to make ourselves less vulnerable to those events, right? We have made adjustments to buildings, we make adjustments to our response plans, et cetera. We have cultures of safety around these events. All of those sorts of areas, and I can go into more detail, if you have questions, but all of those types of approaches are absolutely the kinds of things we can do for pandemics. Imagine if at the start of COVID-19, someone had said, this virus that we are seeing causing a really concerning outbreak initially in China, it's spreading between people. That means it's going to be a pandemic. Respiratory viruses move around the planet really fast. It's going to be everywhere really quickly. Let's get ready. Let's make sure we have enough tests. Let's not keep tests under a lock and key in hospitals. Let's make sure that people can test themselves regularly so that instead of having to stay home for at least half a year or a year, they get to test themselves before they gather so they can gather safely. Let's make sure we have improvements to our indoor air quality so that when we gather, we're less likely to have super spreader events. Let's make sure that we have plans for when more people need care, for when our care, than what our normal care have. There's just many, many categories of things that we could do if we treated these pathogens like what they are, which is that they're recurring hazards. Just like we are going to expect to see more floods and more extreme storms, and we have to make choices around that to reduce our vulnerability to them. We can also reduce our vulnerabilities to infectious disease emergencies. So H5N1, let us hope it doesn't do more. Let us hope that our 20+ year worries about this virus continue to be that. Someone once recently showed me a picture of an article that I wrote that said the next pandemic ? And it was all about H5N1, and it was written in 2004. I want to continue to be wrong about this virus. But even if I'm wrong, as I hope I am, there's going to be something else that's going to come around. And so let's take steps now. Let's use this situation as the exercise that it is. We don't often get advance warning. Let's treat it like it is. Take advantage of this. I think one of the things we have to do is take much more seriously our jobs of protecting farm workers so they can continue to feed us, so that we can show up in the store and buy eggs and actually see eggs on the shelves and not have to pay what we're paying. There's just many more steps that we can do. But if we were to do that, we'll not only deal with H5N1, but we'll also have a society that is just better equipped for these threats, so that when someone says, how worried should I be? I say, well, you don't have to worry, we got this. So anyway, I'll end there and happy to take questions.
Thank you. So as we transition into the Q&A portion, I just want to remind us that Jennifer's going to repeat your question into the microphone so everyone knows what was asked, and also for cable access.
Okay. Thank you. Yes.
We have backyard chickens, and how can you protect your backyard chickens from?
Yeah, so I should have given the preface that I am the question is, how do you protect your backyard chickens? I should have prefaced that I am a human epidemiologist. I am not an animal health expert. But I will say that what we are hearing is that the domesticated birds are getting it from the wild birds. So one of the things is about covering and trying to reduce the contact between domesticated birds and wild birds. I also think that general, they call it biosecurity practices, would mean try to reduce the likelihood that you could bring a virus into the area of the chickens and out. So, making sure that, you're cleaning things that go in and cleaning things that come out, and crucially you and your clothing and things like that. Yeah. Yes.
Do they know if it's respiratory transmission in the animal populations versus contact, or?
Yeah, so we don't fully know. Sorry, the question is, I have to get the, sorry. The question is, do we know how the animals are getting it, if it's respiratory transmission or not? We don't fully know. For the cows, it seems quite likely that equipment might be involved, that somehow during the milking operations, either because the equipment itself is contaminated, the virus could actually enter the mammary cells if the equipment is contaminated, or it is also possible that the milking operation itself may be aerosolizing the virus. We don't truly know how it's spreading between animals. And it's likely probably a few factors. One thing is that initially the movement of cows was likely taking the virus from, first we saw it in Texas to then other states, because apparently in the dairy industry, cows are in certain parts of the country, cows are shipped in between states. So that probably played a role. Certainly the migratory birds that may carry the virus may also have played some role, and particularly on the starting the outbreak on farms. USDA has also said that people and moving equipment between farms may matter. I will tell you, the studies that I've seen are not what epidemiologists would like to see. They're more an accounting of the practices of the farms that have been affected, which doesn't mean that those practices are different than the farms that haven't been affected. So in epidemiology, we would like to see a control group to be able to say, yes, that's an unusual practice, and that's why that unusual practice was associated with infection versus not. So I would say we don't really know. I want to be clear, though, we haven't seen evidence of people spreading it to each other, except for very limited circumstances. But one of the concerns would be whether people could spread it, and influenza is typically spread through the respiratory route. And so looking for evidence of whether or not that has happened yet, and if there is evidence that it could be spread between people via respiratory symptoms, that would greatly heighten our concerns of basically, if I heard about two people if I heard of people spreading this virus to each other via respiratory, that would be a pandemic. It would be everywhere within a matter of it'd be in all parts of the planet very quickly.
Do they cull whole herds of cows if cows are identified?
So the question is, do they cull herds of cows? The answer is no. And again, I'm not an animal ag expert, but my understanding is that a few things. One is that the virus doesn't kill cows in the same way that it kills chickens or other poultry. So the threat to the industry is not the same. The other thing is that cows are expensive. And also, I do know that and I don't know to what extent this is happening, but my understanding is that the cows may not die, but they experience decreased milk production. they may recover from, they may not, depending on how severe the decrease is and for how long they're sick. The dairy farmers may choose to sell those cows for beef. So they're not culled in that sense, but they are sold into the beef industry, the beef sector. Yeah.
What can you say about new federal restrictions on communications about H1N1, H5N1 out of the public health departments, and how concerned are you about that restricted communication access?
So the question is, how concerned am I about, or what can I say about the restriction of communication from federal health agencies? I'm deeply concerned. This is probably one of the worst moves we could make, because in this moment, communication is our biggest tool. You know, I say worry is not a public health intervention. Communication is a public health intervention. And the freeze in communications has been multiple. You've heard the story about taking down data sets and tampering with data sets for political reasons, not scientific ones. The thing that I'm most worried about is that our national health agencies are not able to speak to our state and local health departments. They are not able to give them regular updates about what's going on with not just this virus, but many other concerning situations. We have an Ebola outbreak going on in Uganda right now. There's also a suspect Ebola outbreak. We haven't been able to rule it out in the Democratic Republic of Congo. There's a Marburg virus in Tanzania. There's Mpox clade 1, which is considered to be possibly a more severe form of Mpox, a virus we used to call monkeypox. That's happening in many, many countries, largely on the African continent. We have the largest tuberculosis outbreak in recent US history happening in the American heartland. We've got this H5N1 situation. So the worry list, the tracking list continues to grow, and now is not the time. I mean, there is never a time, but it is incredibly important for our health agencies to be able to deliver information to the American people, but crucially, the state and local health departments, whose primary responsibility is the protection of our community's health, and they cannot do that without that information.
Communication with the World Health Organization.
Yes, communication with the World Health Organization. I mean, this is, I can't think of a better way to shoot ourselves in the foot as a nation than to restrict this communication. Yes, gentleman in the blue jacket.
Thank you very much for the information. Fortunately, we don't have any cows, chickens, or waterfowl in this area, so no one here is worried. My question is, can we keep our bird feeders up?
That's a good question.
The question is, can you keep your bird feeders up? I'm not particularly worried about your bird feeders. I was on NPR this morning and someone called in and asked about replacing the suet in your little, wash your hands. I mean, but you would have lots of reasons to do that. Birds can harbor other pathogens, so I'm not worried about that.
Thank you.
Yeah.
Over here.
Sorry.
So I work with the Global Health Department, and we have our first suspected case of H5N1 in a wild goose in Westport. The question is exposure to sick or dead birds, wild birds, as opposed to the domestic poultry industry. What advice do you give, and especially for our animal control officers who has to deal with these?
Yeah. So the question is what do you say to people about handling dead birds? Sorry, shorthand of the question. You know, I think you take the precautions that you would often want to take with handling dead birds, which is to try not to touch it directly if you can, using gloves, wash your hands, etc. This virus is not a super virus in terms of its environmental stability. So if the bird's been out there for a while, I of course wash your hands. I don't worry about it really aerosolizing. The poultry workers who were sent in, I mean, they are sent in to kill these birds and stuff them in, and there's fans blowing, and so if it were a flock and you're worried about the possible aerosolization of the virus because there are a lot of dead dead birds and possibly a lot of things that could be stirred up in the process, then, I think respiratory protection, eye protection is, warranted. But if there were just a bird dead in the yard, I think, you would dispose of it and wash your hands like you would normally want to. Yeah.
What do you know about this infection in cats?
Infection in cats.
Domestic and
Yeah.
cats.
So cats have gotten infected, and in fact, this is one of those other data points that I consider when I think about, I don't think this virus, I'm not calling this some people want to kind of write off the recent cases that we've had, like, oh, they've largely been mild. When I see what the infection has done in cats, cats that have been infected, in some cases have gotten very ill, and they've had really terrible symptoms like neurologic symptoms. And I'm speaking largely of cats who may have been infected. We don't fully know, but one possible hypothesis, and some of these data points come from cats on dairy farms. And the idea is, well, did they get them from the birds or did they get it from spilled milk? This is actually one of the points that people cite when they say you should not drink raw milk if you want to avoid this virus. So I think it is concerning. We have in the past, for other influenza viruses, seen pets able to spread infections to their owners. And we know that pets can be infected with this virus, but we're not seeing people really, except for these, we don't know with some of these other, there's been a few cases that haven't been in farm workers, say, or people with chickens in their backyard, where they've gotten it. I would just say that if given how widespread the virus has been in wild birds, and given how you can imagine many cats go after wild birds, if this were a major problem today, I think we would have seen a lot more cases with infections that we don't know where they got it from. So just to say that at this point, obviously I think you should try to discourage your cat from chasing birds because of the potential risk, but I don't think for me it's not a huge source of concern today. Yeah.
How does it present itself?
Yeah.
And is there treatment for it?
Thank you. Yeah. So the infections that have happened, so the question is, thank you for reminding me.
I'm so sorry.
How does the virus present itself and are there treatments? The initial infections, these were in dairy workers that we saw recently, they had conjunctivitis initially. So and I say that and you think, well, my kid had conjunctivitis. No, if you actually see the pictures from some of them, very bloody eyes. Really not a great thing to get, but didn't require hospitalization and they didn't die from it. Subsequent cases have had a mix of symptoms, from conjunctivitis plus respiratory symptoms, sometimes just respiratory symptoms, sometimes respiratory plus GI symptoms, a variety of things. Some people have had very mild. In the case of the hospitalized teenager, it was like a severe influenza. And are there treatments? Yes, there are treatments. This is an influenza virus, so Tamiflu and antiviral medication is something that's being given. It's challenging because they work better when they're taken early. There's some questions about how to dose people. I'm not a clinician, so I'm not going to say more than that. But yes, there are treatments available. This is not like COVID-19, where in the beginning we had absolutely nothing. Yeah. Sorry, maybe you can just call on them because I can't quite see anybody. Okay. Sorry. Yeah.
So you mentioned a teenager who got very sick, and that your hypothesis is that the virus mutated within that person. Is that how epidemics get started? Because he's going to be exposed to a lot of human beings there in the hospital.
Yeah. So this teenager. So there have been some recent papers, to just say it's not my hypothesis, there was a paper that suggested that that's what happened. The teenager did not spread it to anybody, so that's good news. So a few things. From a, is this going to cause a pandemic standpoint, the fact that the virus mutated in the person is somewhat less concerning. I would be more concerned if the teenager picked up the mutated virus from the environment, meaning that there's this mutated virus that's capable of causing severe disease and it's out there. I think that the concern about the fact that the mutation occurred in the patient means that it's just really hard to know who's going to get very, very sick and who isn't. And one of the reasons why we should treat every infection with concern. And not downplay the risks of this virus just because we've had 67 cases, most of which have been mild. When you talk to virologists and ask them, what's the most likely scenario for a pandemic to occur? They describe less the kind of small mutations that occur as this thing is in a person, and as it copies itself, it may make some errors, and then it has kind of small changes that may be important for that person, but what they describe is not that. What they describe is larger changes in the genetics of the virus, such that we talk about it maybe swapping genes with another influenza virus. And you've probably heard that there was worry, one of the mammals that the virus showed up in, which was another one of those red flag moments, it showed up in pigs. And that was a red flag, one, because yet another mammal that humans have a lot of close contact with. But also, pigs are particularly concerning because humans and birds have different types of receptors in our respiratory tract. And we have some of each, but pigs are like the midpoint between birds and humans. And so the worry is that if it's circulating in pigs, they call it sort of a mixing vessel. Does that give the virus kind of the opportunity to train on the more human-like receptors? So that is one concern. But I would say that as much as we're worried about pigs, I'm not convinced that we need a pig to do the mixing for us. One other possibility is that a human could be infected with both a human influenza virus, a seasonal influenza virus, and H5N1, the avian influenza virus. And in that human, could those viruses swap genes such that then we create a new virus? Now, you know, that I think that's one of the scenarios that worries me. And now that we are like fully in flu season, you know, that's really been the concern. So certainly try to get flu shots if you haven't yet. But that is one of the concerns. We don't know what it will take. There are virologists who look at certain genes and say, well, you know, it only has some of these, but not other ones. I want to say that like it's very hard to extrapolate from looking genetically at what it will do on a population level. Yeah.
Back to our tweet. So how concerned are you about USAID being cut? Do they do a lot of work in controlling years of the pandemic?
How concerned am I about USAID being cut? It's devastating. I don't think people understand the role that USAID plays. I think at the national political headline level, it sounds like we're sending American taxpayer dollars and giving it to other countries. First of all, I don't think we understand what that money does. And that money is used, first of all, to pay people, a lot of Americans, a lot of American companies, a lot of American NGOs, to do work in other countries for a variety of purposes, including national security purposes. But from a purely public health standpoint, I'll tell you, one of the things I'm concerned about is that we learned that a key USAID program, PEPFAR, you may have heard of it, it's the President Bush established it to do a number of things, including provide antiretroviral medications for HIV infections in low-income countries. It doesn't just do that. It does a lot of other things that we rely on to detect and respond to outbreaks so that they don't become pandemics. So one of the things we learned is that that money was used to pay for the ability to transport specimens to a laboratory from sick patients that's useful in being used in the Ebola outbreak that's currently going on in Uganda. There are many stories like this of where USAID assets and employees are really essential in the response to overseas situations that directly benefit us. So it is devastating. It is absolutely devastating.
Can I just do a follow-up? It wasn't really a question. It was more of a request, maybe, because I don't think people know it. And so if people can write letters to the editor, really explaining why it's relevant.
Yeah. So the request is please make your voices heard on this. This will hurt us in a multitude of ways.
Yeah. You mentioned that with the current administration, data coming out is uncertain. Mm-hmm. Are there other places, other countries that people could look to for the equivalent of, NHS, etc., where they could get information about the severity or not of bird flu and other potential pandemics?
Yeah, so the question is, with questions about the U.S. health information environment, can we look to other countries? So at a general level, yes, and we do. So if you remember during COVID-19, a lot of what we learned about the virus, the SARS-CoV-2 virus and the disease that caused COVID-19 did in fact come from other countries like the United Kingdom and Israel, places that had better data systems than we have. Often places that have universal health coverage and single payer systems, so they can mine large data sets to understand how these pathogens affect people and get answers to questions like, are the vaccines working, and if so, how much, and do you need boosters, and things like that. So yes, we do. And we will continue to look to that. And since I've been very vocal in the media about the data situation, and I get a lot of friendly requests like, come to Canada, we have lots of information here. So yes, thank you, Canada. I appreciate the information that you have and are very willing to share transparently. That said, there are a lot of problems. One is that right now, the most number of H5N1 cases that are occurring in the United States. So no other country has that information in the same way that we should. Two, in order to protect our communities, the American people need information from the CDC. State and local health departments need information from the CDC. No amount of foreign data is going to be a substitute for information that tells us what is happening on American soil today. So there is just no replacement for that.
I'm curious to learn a little bit more about the reality of how quickly we could roll out a test. You spoke earlier tonight, and that lady, Dr. Burks, several weeks ago on Sunday morning, talked about the CDC should be really focused today on the test. But do you need a lot more victims, human infected people, to roll out an effective test kit?
Yeah. So the question is, how quickly could we roll out tests, and kind of remembering what happened in COVID-19 and how hard it was to get tests. And truly, when I talk about how we can make ourselves more resilient, less vulnerable, about take pandemics off the table in terms of these events that like upend our lives, that testing piece, making sure we activate on that quickly is key, because that was probably the original sin of the United States response to COVID-19. Not knowing where the virus was or where it wasn't made us do all sorts of awful things like shut down cities and schools and all sorts of things. So really, really important. I'm glad we're talking about testing. As far as H5N1 goes, it is an influenza A virus, and our seasonal influenzas are typically influenza A viruses. So we have influenza A tests. So if you had H5N1 and you went to your doctor's office and you got an influenza A test and it's positive, it would be positive. So yes, we actually have tests. Good news. If you needed to know if you specifically have H5N1, which I would argue you do, because this virus is not truly behaving like a seasonal influenza virus. That part is a little bit tricky, and it depends on where you live and what provider you go to. Initially, some states outside of flu season were requiring that if somebody tested positive for influenza A, which outside of the normal flu season would be unusual, that gets sent to a laboratory to, they call subtype, and to figure out what kind of influenza A is it. The worry is that as flu season is really raging right now, the abilities to do those kinds of tests are more limited just in terms of capacity. And so this is one of the reasons where people have been arguing for, we need to make sure that like every commercial laboratory can do it. The issue is not technical, the issue is in part payment. So will insurers pay for you to get an H5 test if they don't? That's one of the questions. Different states have different policies. So I was on NPR today in Ohio, and I learned that if you are someone who tests positive for influenza A, and I think this is largely just happening in hospitals, but maybe not, and you are someone who would be at high risk for H5N1, probably because you had exposure to animals, then that would be your test would be, your specimen would be sent for subtyping. But again, it's going to be one of these patchworks depending on where. Now you're probably also wondering, what about rapid tests? And there are flu A rapid tests, and there now, thanks to the COVID-19 pandemic, actually flu A rapid tests that you can buy at the local pharmacy and take home and test yourself.
Will that test tell you the difference between?
It'll tell you have the flu.
That's all.
Yeah, it'll tell you have the flu. It's good. I mean, we didn't used to have these things. Like, we have to remember the progress and remember the important developments that have been made, some of the successes. So this is great that you can now go out and get a test yourself at home, figure out that you have flu A, and then crucially try to get medicines for your infection quickly. That's really important. Decentralizing that's really important. Problem is those tests are still really expensive, and right, they don't tell you H5N1. Now there's a challenge here, because right now this virus is not spreading between people. Right now, again, I said worry is not a public health intervention, but if you ask me who I am most concerned about, it's farm workers, people who work in agriculture or have some reason to be, are likely to be exposed to the infection that's happening in animals. That virus is not the same virus as the future pandemic virus, right? So if the future pandemic virus emerges because somebody got infected with that plus a seasonal flu, it's going to be a different virus. And so the question of what tests would people need and whether the ones we have would work, we don't have the answer to. Take all of that I just said and apply that to vaccine. And I'm sure someone's gonna ask me about vaccine, but just to say that when we're talking about responding today, what we really mean, this is an occupational hazard for farm workers. This is not something that the broader community yet has to be concerned about for their own personal health.
Thank you.
So in light of the fact that there's going to be limited or no communication from the government, is there any alternative ways for people to communicate with each other amongst at least universities or other things? Or is it being thought about to try to put together some alternative way to communicate?
So the question is, what do we do? What are the alternatives if the feds can't talk about this information? So I'll say a few things. First of all, there is no substitute for the federal government. The federal government has a really important role to play. And I say this as someone who, during the COVID-19 pandemic, before I came to Brown, I was at Johns Hopkins, and I was part of the team that worked on the COVID-19 map that you may have seen. That map was created by my colleague at Johns Hopkins, Dr. Lauren Gardner, initially as a research project, but it became, for quite a while, the only place that you could go to get up-to-the-date information about COVID-19 cases that were happening across the world. I'm enormously proud of the work that we did on that site, but I will tell you that was not ideal. It should have been our health agencies doing that. The reason why is that it's their job to protect public health. That said, I think there are some lessons there, which is that where there's a will, where there's a way, and you can't really keep this information under lock and key. the ingenuity of the scientific community will rise to the occasion, and already we're seeing that happening. So people started getting a signal that there was going to be issue with data. I know colleagues who have downloaded the entire CDC website. I know colleagues who have downloaded all the data sets and have stored them. That is great. And it just speaks to the ingenuity of scientists who are like, oh, hell no, not on my watch, right? However, going forward, there's questions about where we're going to get the new data. Now, this is where perhaps being in the United States offers one advantage, which is that in the United States, this federal country, the primary responsibility for collecting data are with the states. This is a state job. They share this information with CDC on a voluntary basis, largely. It's voluntary. They do so because they see value in getting the national picture. And because sometimes, again, why there's no substitute for the feds, which is that sometimes there's stuff you only learn when you look at things in aggregate, right? But the way that we were able to create the Hopkins map was because states reported the information and we scraped that information from states and put it somewhere centrally. So I think there will be something cobbled together. It may not be complete. In many instances, we not only by putting it together in a non-governmental place, it actually kind of increased the pressure on states who maybe didn't initially want to report these things to have to report it, because the media would look and say, hey, why isn't this state reporting this information? An engaged populace would call their governor and say, how come you're not sharing this information, et cetera. So I think that there are other ways, but it's far from ideal, because not only do you want the people who are, the agencies that are statutorily responsible for the protection of public health to be the ones fulfilling their statutory responsibilities and acting upon those data, they also have the context for the data that those of us on the outside don't. And so very often, we get questions about data and changes in data, and we would have to go to the local media and ask them, can you figure out why these data look differently than they looked the day before? If we were the people who were in that real data pipeline, we would have known the answer to that. So it's not ideal to be done on the outside, but if it needs to be, it will.
When the SARS-2 vaccine was rolled out, they gave first responders, hospital workers first. Is there anything to get a vaccine to the farm workers?
Yeah, so the question is about giving vaccine to farm workers and talking about kind of prior, like often when we have a situation where we want to start a vaccination campaign, we sort of prioritize, we give it to some priority group. So the good news about fretting about this virus for as long as we have is that those outbreaks that were happening in the early aughts really helped galvanize pandemic preparedness in a much broader sense, including the United States government took steps under the Bush administration to create an H5N1, to create and stockpile H5N1 vaccines. So we do have vaccines stockpiled. And these vaccines could be used for farm workers. They could be offered to farm workers. And I and many other of my colleagues have been arguing that we should do just that. There are debates about that, including debates over whether it's necessary given the fact that the farm worker infections have been mild. My argument is we shouldn't wait for a farm worker to die to take steps to protect them, particularly if we have the tools. Finland is doing that. Finland is getting vaccine and it's offering it to its agricultural sector. My understanding is that some of the hesitation to do that here in the United States is as much to do with the difficulty of reaching and tracking farm workers. I think there's also open questions about whether the vaccines will be wanted. I will just say that's something that really, really frustrates me, because we have learned over and over again that you just can't make a vaccine and assume that everybody will believe it is safe and necessary and to their benefit. You have to work to stimulate demand for that product, and that includes explaining to people the risks and benefits and why it may be in their best interest, and then allowing them to choose whether it is in fact in their best interest. But that is part of the process, And so I think just kind of assuming, well, they won't want it is, first of all, not based on data, and also, frankly, incredibly paternalistic.
Thank you.
Yeah.
So, kind of a follow-on.
Yeah.
You mentioned that H5N1 now is not the H15N that might cause a pandemic. So it's a different virus. Do you think that the mRNA vaccines that develop COVID might be able to be used to accelerate the development of a vaccine for H5N1 that does cause a pandemic? And are we going to see, second question is, as you mentioned, given the pushback there was to the COVID vaccine requirements, are we going to see something similar for H5N1 vaccine should it be necessary?
So I'm just going to, so your question is, given that the pandemic virus is not H5N1 that we know of, I mean, it may not be H5N1, we don't know what the pandemic, given that we don't know what the pandemic virus is, like what's the role of mRNA vaccines to imply it because of their potential flexibility, and then also, do you think we'll have the same kind of pushback that we saw during COVID-19? So we don't know what the next pandemic virus will be. We have H5N1 vaccines stockpiled in various states of sort of development. Those are largely vaccines made from the way traditional flu vaccines are, meaning that they're typically grown in eggs. And the difference is that they may require an adjuvant, which is a kind of chemical that you put in to kind of stimulate your immune systems, just to kickstart it, because your immune system's never seen the virus before, so you got to give it a little extra push. But we don't know if those vaccines will be effective against what the pandemic vaccine is. So that's one of the reasons why at the end of the Biden administration, you saw a number of contracts between HHS and companies that make mRNA vaccines. The idea being mRNA is a theoretically more nimble process whereby you decide what you want the vaccine to be, you can more easily create it, and it should potentially be a faster turnaround. I think it is important that we have multiple options, and I think mRNA will be an interesting option. We just don't have those vaccines yet, so we don't know if they're going to work. I don't have reason to think they wouldn't per se, but we actually don't know. So there's a giant scientific question there. They're in an earlier stage of development. There is also a regulatory process that it has to go through, and one of the things we've learned is that regulatory process is not necessarily as nimble as one would hope, given the proposed benefits of mRNA vaccines. So I think my biggest example of this is this summer we had a fairly robust COVID wave that happened this summer. And then the mRNA boosters came out in early September, which was largely after the wave was over. So it's one of those frustrating things where we sort of wish we had the booster 3 months earlier before that wave. Now we fortunately had one of the quieter COVID-19 winters that we've had in a while, likely because of the intense COVID activity over the summer. So it was a little bit frustrating that the mRNA boosters didn't show up until really after that period of need. So I just have giant questions about that. Will I see pushback? I mean, again, nothing is predetermined. It is always the job of medicine and public health to stimulate demand for vaccines. That is always the job. I think this idea that there's going to be entrenched hesitancy may be true, but also doesn't speak to the need that you have to work actively to educate and connect with people about these vaccines. And we never build that into the process enough. So I don't doubt that there'll be people at the beginning who will not believe that that's in their best interest. I also don't doubt there are some people for whom, I think for a lot of us, vaccines have unfortunately become this tribal identity thing where you're either for it or against it depending on your politics. And your decision around the vaccine will in part be determined by that. And I really, really regret that we are like that, because that's not the way, that's not a good way for us to be. That said, if this virus is killing 50% of the people who get it, it changes everything. It changes everything. So, you know, do I think that's going to happen? I literally don't know. But just to say that people make decisions based on what they're seeing. And if they are seeing anything like what we imagine they could see, it's a totally different conversation than I think where we are now when we talk about vaccines in the hypothetical.
The city of Brockton shut down DW Field Park because of dead birds. Last weekend they canceled a road race with hundreds of people because nobody is allowed into the park. Is there any chance something like that could happen in New Bedford with, let's say, the ducks at Buttonwood Park?
I'm going to say, so the question is a park, I'm sorry, Brockton closed.
DW Field Park.
Okay, closed a park because of dead birds, that's horrifying. And the question was if it happened in New Bedford. I'm not a vet, but I don't see why it couldn't happen, like why you couldn't have a bird die off in another, not very far away place, given that birds fly. Sorry.
That one right there.
Are you concerned about farm workers being populated by a lot of migrants and failure to report illness or seek care because of their concern about their status?
The question is, am I concerned about farm workers given perhaps migrant status and being unlikely to report? I am worried about farm workers for a lot of reasons. I was worried about farm workers even before this political moment we're in, where immigration is a huge political flashpoint. I'm worried about farm workers because getting sick with this virus means you can't show up to work and earn income. You might lose your job. So that was a problem. That's a day one problem. And it's not just this virus. I mean, I, in my research, studied an outbreak of mumps that was happening on a mushroom farm. That was the exact same scenario that happened. The immigration aspect, people worried about their immigration status, but also just, there are huge economic disincentives for people to say, yes, I'm sick, and I shouldn't be at work. We just can't. So I have been worried about this, and one of the reasons why I've been arguing for making vaccines available to kind of make it easier for people given these economic constraints. But the political moment we are in is absolutely going to drive cases underground. We're already seeing certain farms where the workers are not showing up for fear that there's going to be immigration raids. Absolutely. The mumps outbreak that I studied happened under the first Trump administration at a similar time of, the dialogue was similar on immigration. And it was happening in a community that actually had good relationships with the farms and good relationships with the farm workers. And one of the things they learned is that the physicians who were treating the workers didn't want to report their patients because they were afraid it was going to expose them somehow. The health department also, could get free vaccines to give, but one of the things that they were required to do was only give the vaccine to people who didn't have health insurance. And when they showed up on farms to try to offer a vaccine, they learned that asking someone if they had health insurance was a proxy question for asking their immigration status. And so they figured out a workaround, and it meant working with a community a community group that was not only a federally qualified health center, but also had some work in the community to help farm worker population, so that they were a trusted group. And that community organization just wound up not losing, paying for the vaccine out of their own budget, which you can do when the outbreak is small, but you can't. So just to say that these are issues that come up over and over and over again. One of our biggest, when I talk about how we can take pandemics off the table, we know that our social vulnerabilities are our pandemic vulnerabilities. We know that today. And instead of pretending that that's not the case, we have to develop pandemic plans that are centered around that reality, rather than just kind of like pretending it doesn't happen.
this already, but I feel sorry for the birds. And I'm wondering if there's any way of putting something into the feed for the farms. Is there any way of averting the influenza from the birds?
Yeah, so the question, and this is, if it was our last question, what about the birds and how do we protect the birds? So there have been attempts, and some countries have chosen to vaccinate their poultry. It becomes challenging because it has, and my knowledge may not be up to date because I'm, again, a human epidemiologist, but my understanding is in some cases that makes it hard for countries to export their poultry products. And so there's some economic disincentives potentially to that approach. And I think that's why you may have, towards the end of the Biden administration, or maybe the last year or so, there were news stories about exploring, developing vaccines for poultry. And nothing's come out of that. I think in part because the economics makes it really challenging.
Tuesday, March 4th, same time, same place, we will hear from visual artist and science writer Anna von Mertens, who will discuss To Clearly See, how astronomer Henrietta Leavitt helps us find our place in the universe. This is about a female, deaf, 19th century astronomer. So please mark your calendars. Thank you.